Hi everybody, so today we're going to talk about the wild hydrangea and its medicinal properties. First off, the name of the wild hydrangea is Hydrangea arborescens. It has some common names: mountain hydrangea, seven barks, smooth hydrangea, and wild hydrangea. In my area, the wild hydrangea is actually fairly common. I live in the Appalachian Mountains, and pretty much you can be driving down the road around here and you're going to see it on the side of the road, or if you're hiking, you're going to find it on the side of a path. Like I said, it's fairly common here. Okay, so the wild hydrangea is native to North America and parts of Asia, and the parts that we're going to use for medicine are actually the roots. The flowers and the above ground parts are ornamental in nature, but the underground rhizome contains many of the active ingredients that make it a popular medicinal herb. Some of these active ingredients include alkaloids and other potent antioxidant compounds, such as saponins, quercetin, and camphorol. While there are more than 75 different species of hydrangea throughout the world, the arborescens species is the most commonly used for its medicinal purposes in America, specifically for its immune-boosting properties. There are many benefits to using hydrangea root. Hydrangea root can limit bladder infections, reduce inflammation, and prevent autoimmune diseases. Hydrangea root can reduce the size of an enlarged prostate, prevent bladder infections by acting as a diuretic, limit the appearance of urethral infections, dissolve kidney and bladder stones, and it fights back against parasitic infestations. Hydrangea root lowers inflammation throughout the body. It reduces the risk of chronic diseases due to its antioxidant properties. It soothes the pain of rheumatoid arthritis and gout. It relieves pain from inflammation and irritated tissues. It strengthens the immune system and helps to prevent autoimmune diseases. Hydrangea root can prevent cystitis in women, reduce the risk of hay fever, treat calcifications, and it acts as an antiseptic and an anthelithic. It has also been used to treat malaria. Human clinical trials are limited. However, in vitro and animal studies have been used to investigate hydrangea as a potential antifungal, anti-hyperglycemic, and an anti-malarial. Additionally, results in an in vivo animal study suggest that hydrangea may effectively prevent male pattern baldness. Unfortunately, studies supporting the use of hydrangea for urinary tract disorders are lacking. When taken orally, a typical dose is 2 to 4 grams of the dried rhizome and root, or 1 cup of tea 3 times daily. To make the tea, steep 2 to 4 grams of dried rhizome and the root in 150 milliliters of boiling water for 5 to 10 minutes and then strain. As a liquid extract, 2 to 4 milliliters 3 times daily, and as a tincture, 2 to 10 milliliters 3 times daily. Excessive amounts may be unsafe for long-term use. Excessive amounts would consist of more than 2 grams of the dried rhizome or root per dose. Contraindications for use would be if there's a known allergy to hydrangea, its constituents, or members of the family Hydrangeaceae. The safety of hydrangea for use while pregnant or breastfeeding has not been established, so avoid use. Hydrangea can cause contact dermatitis, and the constituent hydrangean may cause gastroenteritis. Hydrangea flowers and leaves may cause toxic symptoms in humans due to the presence of the cyanogenic glycoside hydrangean. There are no known drug or supplement interactions with hydrangea, and hydrangea is classified as an herb of unidentified safety. So there you have it, folks. We've come to the end of our little conversation about the hydrangea root, and I sure appreciate you stopping by and listening to my little lecture. Thank you.